Dr. Donald Hohman, orthopedic surgeon with the Texas Orthopedic Associates in Dallas, Texas. I'm a board-certified, fellowship-trained joint replacement surgeon. I specialize in joint replacements of the hip and the knee. On the knee replacement side, what I tell patients to expect are as follows. Partial knee replacements are a really nice operation when you can find the right candidates for that, because people tend to recover from those a little bit quicker than they do a full knee replacement. The reason is that in essence, it's about 1/3 of the surgery. And so it's 1/3 of the blood loss, it's 1/3 of the dissection, it's arguably 1/3 of the pain if you think about it that way. And so while we have a really effective multimodal program for pain control, patients are really generally very comfortable after both a partial knee or a full knee. Patients tend to recover a little bit faster from a partial knee replacement. What I tell those people is they're usually pretty good in the first 3 or so weeks, maybe 4 weeks. I also use a metric where I tell people that they make the bulk of their recovery in the first 3 months, and then they'll even continue to make small improvements over a year, year and a half after surgery. So I don't tell people they're at any time that they are where they're going to be until they get to that point. For a full knee replacement, generally those take a little bit more time. People need to be a little bit more patient just because it's a lot more surgery. It's a lot more to rehabilitate. It's a lot more to recover from. It's more stress on your system. So what I tell my knee replacement patients is that you'll be really pretty good by about a month or 6 weeks. That's with the caveat that generally we like to have everybody home. So it's not like you're totally bedridden or incapacitated for that time. You're still up doing your normal things, your day-to-day activities. Maybe you need a little bit of help. Maybe you're a little bit slower than you might normally be. But generally, people are doing really pretty well by about a month, 6 weeks. And again, when it comes to the full knee replacement, we make the bulk of the recovery in the first 3 months and continue to make the improvements for the year, year and a half after the operation. Those are slow improvements in your strength, slow improvements in your range of motion. You continue to get better and stronger over that year, year and a half. The way I communicate that to patients is that I just remind them, look, your hip or your knee didn't suddenly go south overnight. It got bad over years and years and years. And so while they had that slow decline, they started to make compensations. Their legs started to become weak. They started to walk differently and compensating with all of the activities that they're doing. And so then we take that leg that is crooked and no longer working, and then we let it bend and we straighten it out. It just takes time for those other muscles and the other compensatory mechanisms to kick back into gear so the patients are back to their baseline level. When it comes to hip replacements, oftentimes my preferred approach for hip replacement is the minimally invasive muscle-sparing anterior hip replacement, and generally those patients recover really quite quickly. That's what I tell my patients is my favorite operation. And so when I can do that for somebody, oftentimes we have patients that go through that entire experience and they don't even require any pain medication. They take only Tylenol for their hip operation. And when I have somebody who has really bad hip arthritis and we do an anterior hip on them, I tell them before surgery, I think you're going to wake up when you wake up from surgery and you'll feel better than you do going in. And they laugh every time I tell them that. I check on them in the recovery room and they tell me they didn't believe it, but they're experiencing it. So people are generally very comfortable after that. And so we tend to accelerate that timeline a little bit as far as recovery. Those patients, oftentimes we have to slow them down a little bit because they feel so good so fast. They try to do a little bit too much and they can even create little problems and setbacks for themselves. So generally by the 2 to 3 week mark, those people are off of any kind of assistive device and getting pretty close to normal really pretty quickly. Bulk of the recovery in the first 3 months, just because it's a stress on your body. Having a joint replacement is a stress on your whole system. And continue again to make improvements, small improvements for a year, year and a half after the operation.